Are you experiencing pain while passing stools? Do you have to push hard in order to pass stools? Are you having bleeding when you pass motions? Do you feel burning sensation on moving your bowels? If the answer to the above questions is yes, then the chances are that you have got hemorrhoids, or what is popularly known as piles. So what is piles? And how do you prevent yourself from the problem? What is the best treatment for this ailment? Today, let's know about the answers to these and any other questions you may have in your mind about piles. When the veins near the anal opening get inflamed or swollen, there is difficulty in passing motions. The condition is known as piles. So there is bleeding and pain, which is often burning in nature, and difficulty in passing motions, wherein a lot of pressure needs to be put in order to evacuate the bowels. Mostly, the person also has constipation associated with the piles. Piles has known to occur in people who have a lots of stress due to workload or other reasons. Faulty lifestyles such as sitting on a hard surface such as a chair in the office for prolonged hours, sedentary lifestyle, lack of sufficient exercise, or eating very spicy food regularly, or foods lacking in dietary fiber such as fast foods, burgers, pizzas, sandwiches, vada pavs, etc. are some of the common reasons for piles. Other causes of piles are smoking, drinking excessively, pregnancy related piles, insufficient liquid or water intake, etc. There are two types of piles, internal and external. Internal piles presents with more bleeding and less pain, whereas external piles are more painful. Bleeding can be seen as bright red blood or dark colored blood. In conventional treatment methods, mostly surgical option is advised for quick relief. But that is just a temporary solution and more often than not leads to a recurrence of the problem after a period of time, because it does not take into account the root cause of the problem that has to be dealt with. So, to treat piles in a more permanent and effective way, a holistic approach is very important. Understanding the lifestyle habits and altering them, adopting better dietary habits like reducing spicy food and fast foods, also including healthy foods that are useful for piles such as bananas, spinach, yogurt, papayas, figs, and plenty of fluid intake in the form of water and other liquids. Reducing alcohol intake and smoking are some of the necessary changes needed to be taken as the first step towards the treatment of piles. Besides this, homeopathic medicines that will be administered after a thorough case taking of the patient, which will take into account the causes of stress and the patient's threshold levels and various symptoms that will vary individually, and understand the patient's needs according to his occupation, etc., is the only best solution for treating piles.